I think a good doctor honestly revolves on how much they care for their patient. There's no question that the most important thing is baseline knowledge, their understanding of their field and their specialty. But I think what it comes down to is the care of the patient. My first introduction to medicine was probably from one of my high school teachers. He was a practicing physician himself and also a researcher. And he motivated me to kind of look into it and dive deeper into the specialty. And that kind of led to the spark, and that spark just kind of unfolded in itself naturally. And I knew that over time I had a desire to help kids. Kids had this unbelievable resolve, this kind of tenacity to return to like normalcy if they had something wrong with them. And so I just found myself naturally gravitating to working with kids. Peds orthopedics, and specifically pediatric spinal deformity, there's so many questions of how to best treat certain pathologies that come your way. The way that technology has advanced so much so that it's so much safer. We use navigation, we use different techniques to hopefully even avoid fusion type surgeries that are really revolutionizing the way that we treat spinal deformity. And I think that's part of the interest in the field, is that there's so much new and upcoming that I'm excited to be part of it. Spine is not just something that you deal from 0 to 18, but always to the end of life. And so we're building a spine center here that's focused on not only children with spinal deformity, but also expanding it into the adult. I would say the most rewarding part of my job is seeing the outcomes. Seeing that children or someone come back into clinic and say, nothing's wrong. That whatever they came to see me for was no longer an issue. And now they have their semblance of normalcy back.